You've probably seen the headlines. Penises are shrinking. Chemicals are destroying men's hormones. It's everywhere. Social media, the news articles, even viral TikToks. And honestly, it's a little terrifying. I'm Dr. Emily Watson, MD, urologist and pelvic surgeon. And today, I'm going to explain what you need to stop doing to prevent penile shrinkage. And it's not cower and fear from environmental chemicals. And number 4 is something that even surprised me, so don't miss it. If you want to protect your penis as well as your sexual health, make sure to check out my brand new app, the Better Sex app, where you get a 24/7 AI coach trained by me, daily health practices, and weekly challenges to help you optimize your sex life, no matter what you're struggling with. It's all for less than $1 a day, and it's 20% off until Friday, January 2nd. So check it out at www.studio.com/Rena. Now, let's get into it. The top 6 things you should stop doing to protect your penis. Number 1, avoid smoking. If you love your penis, please don't smoke. This is because when you smoke, it damages your penis in not 1, not 2, but 3 different ways. First, it destroys your blood vessels. Smoking causes something called endothelial injury. That's basically damaging the inner lining of your blood vessels. And guys, good erections need good blood flow and healthy blood vessels. When you don't have those, you can't get and maintain erections. The chemicals in cigarette smoke directly affect your body's ability to produce nitric oxide, which is the ignition for erections. And without it, you get weaker and shorter erections. Second, it causes oxidative stress and tissue death. Basically, what happens is it floods your body with harmful reactive oxygen species. These are molecules that essentially attack the blood vessels and the erectile tissue inside the penis, causing cell death. This means that your tissues lose healthy, smooth muscle and blood vessel cells, or endothelial cells, and it's replaced with scar tissue, which doesn't expand like healthy tissue does. And the third way is it causes structural changes and fibrosis. When you smoke for long periods of time, it increases collagen deposition in the penile tissue. Think of it like your penis is becoming stiffer and less elastic. And studies have shown that heavy smokers have measurably less smooth muscle content and more fibrous tissue in their penis compared to non-smokers. This fibrosis or scarring then makes it difficult for the penis to fully expand during erections, meaning you have a shorter and a less girthy penis. Fortunately, studies do show that men who quit smoking can see improvements in erectile function and blood flow. The earlier you quit, the better your chances of preventing or reversing these changes. Number 2. Avoid weight gain. Now, technically, your penis doesn't physically shrink when you gain weight. But here's what happens. When you gain weight, you also gain weight in the fat above the pelvic area, or the fa. And this then makes your penis less visible. Because the penis is not just what you see on the outside, it actually dives deep and curves and goes down to the perineum. Basically, you don't actually lose length, but you lose what you're seeing. And some men can lose up to 1 inch of penile length because they've gained so much weight. Number 3, use it or lose it. Now, I'm not a huge fan of this term because it makes people feel like if they're not having sex, something's wrong with them. But there is some truth to it. So, what happens when you have an erection is you're bringing oxygen-rich blood into the penile tissue. And this oxygenation is important because it keeps that tissue healthy. And your smooth muscle cells and all the erectile tissue cells, they need regular oxygen to stay functional and elastic. But if you are a healthy individual, even if you're not having sex or masturbating, your body protects you because you get 3 to 5 nighttime erections. And during those nighttime erections, your body is sending that healthy, oxygenated blood to the penis to help maintain the health of the tissues. And that's why also you wake up with morning wood. Now, when you become unhealthy because your blood vessels are unhealthy due to things like high cholesterol, diabetes, high blood pressure, heart disease, then you stop having these nighttime erections and you no longer wake up with your morning wood. And this is when the problem occurs. Your tissue's not getting oxygen, and over time, this leads to shrinkage. In fact, we see that men who don't have any erections for 3 to 6 months actually lose 1 to 2 centimeters of length. If you start noticing that you're no longer having erections during the day and at night, make sure you talk to your urologist and your primary care doctor. Number 4. Now this one surprised me. Don't let your kids become obese. The reason for this is there's evidence that kids who are obese ultimately have a shorter penile length as adults. And how do we know this? Well, there was a small observational study done in Vietnam, including 290 adults, and essentially what they did was they measured their penile size and dimensions, and they compared it to their childhood BMI, which they estimated by using 3D models of their childhood photos. And these were any time before the age of puberty. And so when they took these measurements and estimated their prepubertal BMI, they found that childhood obesity was linked to having shorter adult penile length. However, when you had obesity as an adult, it didn't actually affect the size. It just affected the appearance because we talked about it, right? When you have fat there, it makes less penis visible. And the reason we think this happens is because before puberty, you're having a critical period of genital development. And when a child is obese during that time, they can disrupt hormonal or growth processes, which are really important for normal penile length formation. And so, what's the take-home? If your child is obese, getting help from your primary care doctor, nutritionist, whatever options you have available to you, might help prevent long-term effects on their penile development. Number 5, don't get diabetes, and if you do, control your blood sugars. Now, this is one that I worry about for myself because I have a strong family history of diabetes, and South Asians were very likely to get diabetes, and it can affect women as well as it does men. But let's keep it focused here. When you have poorly controlled diabetes, chronic high blood sugar actually damages tissue. It causes cell death because of multiple different changes that occur. One is that there's inflammation in the penile tissue. So the healthy, smooth muscle then dies off and is replaced by dense, fibrous scar tissue. Sound familiar? We talked about it with smoking. It also reduces the elasticity and the actual size of the penis. It damages blood vessels by reducing the production of nitric oxide, again, the ignition for erections. And it causes nerve damage, specifically damaging nerves that regulate blood flow and sensation to the penis. This ultimately leads to tissue atrophy, or wasting away of the tissues. If you're managing your diabetes, you're doing well. It's not a huge concern. However, if you have uncontrolled diabetes and the longer it goes uncontrolled, the more smooth muscle you lose, the more fibrosis you develop. Now, if you keep your blood sugar well controlled, you're protecting your penis. So if that's you and you're diabetic, keep your blood sugar in a healthy range. Monitor your hemoglobin A1C regularly, and if you have erectile dysfunction, take it seriously. Talk to your doctor and get erections back. Next up, don't ignore penile changes. Specifically, Peyronie's disease is a condition that is often associated with a curvature of the penis, and it causes plaque formation on the penis. And when you develop curvature, it can also cause penile shortening. Now, there's no surefire way to prevent this, but we know there's some predisposing factors. One of them is penile trauma. We suspect that Peyronie's disease often develops into microtrauma that happens during, vigorous sexual activity. Now, before I say stop having fun in your sex life, I think novelty is very, very important. But there are some things you can do to prevent injury. One is use adequate lubrication during sex. Two is try to avoid really aggressive or high-risk sexual positions that might put your penis at risk for bending or buckling. And if you find yourself wanting to be experimental, make sure you're in full control so that you don't get injured by your partner being in control and sort of falling or hitting you in the wrong way. Another way to potentially help prevent Peyronie disease is manage your underlying health conditions. We're seeing more and more evidence that conditions like diabetes, obesity, and cardiovascular disease are associated with an increased risk of Peyronie disease. And the theory is that these conditions affect blood flow, promote inflammation, and can impair normal wound healing, all of which might contribute to this abnormal scar tissue formation in the penis. And lastly, if you start noticing pain during erections, a new curve or bend in your penis, make sure to see the urologist. 1, we want to make sure it's nothing serious. But 2, potentially if we can get you to start making changes or offer you treatment options sooner, we might be able to preserve length before it gets worse. All right, and there you have it. The top 6 things you have to stop doing to prevent penile shrinkage. If you guys enjoyed this video, make sure you share it with someone who finds it interesting, because guys, you don't talk about sex enough and you need to be sharing this content with your friends. Make talking about sex normal, because otherwise there's so many guys suffering in silence. Let's be the change. And as always, remember, take care of yourself because you are worth.